Good morning, everyone. My topic for today is place and causes of acute cardiovascular mortality during the COVID-19 pandemic. Moderator is Dr. Shyam Prakash sir. Article taken from a British Medical Journal. Introduction: cardiovascular disease is one of the most prevalent underlying conditions associated with increased mortality from COVID-19 infection. But there is substantial reduction in presentations to hospitals with acute cardiovascular conditions including acute coronary syndrome, heart failure, cardiac arrhythmia, and stroke during the pandemic. In this study, we have evaluated the location of cardiovascular deaths, examples hospitals, home or care homes, their relation to COVID-19 infection, and the specific CV fatal events that contributed directly to death. This information is vital for the understanding of healthcare policy during the pandemic. Coming to objective and methodology, the analytical cohort included all certified and registered deaths in England and Wales of age more than 18 years between 1st January 2014 and 30 June 2020, recording in the civil registration death data of the office. Acute cardiovascular deaths were based on any of the 10th revision of the International Statistical Classification of Diseases and Related Health Problems codes corresponding to the immediate cause of death and contributed causes registered, as stated on the medical certificate of cause of death. Cardiovascular events directly leading to death, called acute CV deaths, were categorized as acute coronary syndrome, which could be ST elevation, MI, NSTEMI, type 2 myocardial infarction, reinfarction, ventricular tachycardia or ventricular fibrillation, heart failure, stroke, acute hemorrhagic stroke, other non-cerebral strokes, and unspecified strokes, cardiogenic shock, pulmonary embolism, deep vein thrombosis, and aortic disease like aortic aneurysm rupture and aortic dissection, and infective endocarditis. Statistical analysis. Baseline characteristics were described using numbers and percentages for categorical data. Data were stratified by COVID-19 status, like suspect, confirmed, or not infected, and within age band of less than 50, 50 to 59, 60 to 69, 70 to 79, 80 plus years, sex, and place of death, as shown in Table 1 in the following. This table shows acute CV deaths before and after 2nd March 2020 by COVID-19 status. Acute CV deaths before 2nd March 2020 and non-COVID-19 acute CV deaths after 2nd March 2020, COVID-19 acute CV deaths after 2nd March 2020 and acute CV deaths after 2nd March 2020. The first column shows sex and next to the age band. The next column shows region and next shows place of death and underlying cause. Between 1st January 2014 and 30th June 2020, there were the above number mentioned deaths from all causes among adults. Proportion of deaths increased with increasing age band up to 50.8% in women. People dying from any of the directly contributing CV categories accounted for 17% of all deaths, of which 6% had at least two of the predefined CV categories that directly contributed to death. Most deaths occurred in hospital, 63%, followed by home deaths of 23.5% and at care home 13.5%. COVID-19 related and total excess acute cardiovascular deaths. COVID-19 related is 1480, whereas total is 2085. So acute CV deaths after 2nd March 2020. Following the first UK death on 2nd March 2020, there were 28,916 acute cardiovascular deaths, of which 5.1% related to COVID-19 and 7.9% is suspected, 92.1% confirmed. and an excess acute CV mortality of 2085, a proportional increase of 8% compared with the expected historical average in the same time period of the year. COVID-19 deaths accounted for 71% of all excess deaths after this date. Qualitatively, excess acute cardiovascular mortality began in late March 2020 and peaked in early April 2020. While hospital remained the most frequent place of acute cardiovascular death, there were proportionally fewer deaths in hospitals, 53.4% versus 63%, and more at home, 30.9% versus 23.5%, and in care homes, 15.7% versus 13.5%. Moreover, deaths at home saw the greatest increase in excess acute CV deaths, a proportional increase of 35%, followed by deaths at care homes, a proportional increase of 32%, and there was no excess acute CV deaths in hospital. The number of excess acute CV deaths were higher more among men than women and were highest in the age category of 18 to 49 years, with a proportional increase of 17%. The most frequent cause of acute CV death during the COVID-19 pandemic was stroke, accounting for 35.6%, followed by acute coronary syndrome, 24.5%, heart failure, 23.4%, pulmonary embolism, 9.3%, and cardiac arrest, 4.6%. Moreover, deep vein thrombosis demonstrated the greatest increase in excess acute CV death, 20, that is proportional increase of 23%, followed by pulmonary embolism, a proportional increase of 19%, and cardiogenic shock, a proportional increase of 14%. The following table shows time series of acute CV deaths by place of death and the percentage and comparison from March to June 2020. COVID-19 related acute CV deaths. Compared with the deaths prior to 2nd March, COVID-19 related acute CV deaths were more likely to occur in hospital, 81.1% versus 63%, much less at home, 7.1% versus 23.5%, and remained of similar proportions to non-COVID-19 related acute CV deaths in care homes. The rate of COVID-19 related excess CV deaths was higher in hospitals than care homes, a proportional increase of 7% versus plus 5%, and less at home, a proportional increase of 2%. The greatest proportional increase of excess COVID-19 related acute CV death was due to pulmonary embolism, 251, a proportional increase of 11%, followed by stroke, 562, a proportional increase of 6%, and acute coronary syndrome, a proportional increase of 5%. Cardiac arrest, a proportional increase of 6%, and heart failure, a proportional increase of 4%. Place and cause of death after 2nd March 2020. The most frequent cause of excess CV death in care homes and hospitals were stroke and heart failure, which compared with acute coronary syndrome and heart failure at home and pulmonary embolism. And finally, cardiogenic shock in hospital. For stroke, acute coronary syndrome, heart failure, and cardiac arrest, the number of deaths in hospital were lower than the historical baseline. This shows the time series of acute CV deaths by cause of death and place of death. Coming to discussion, the study shows that pandemic has resulted in an abrupt inflation in acute CV deaths above that expected for time of year. Nearly half of deaths occurred outside of the hospital setting, either at home or in care homes, with people homes witnessing the greatest proportional increase in excess cardiovascular deaths. The most frequent cause of acute CV death during the COVID-19 pandemic in England and Wales was stroke, followed by acute coronary syndrome and heart failure. The major cause of acute CV death were difference between hospital and community setting. The differential of cause of death by place provides an understanding of how the infection and public response to the pandemic played out. The most frequent cause of excess acute CV deaths in people's home was acute coronary syndrome in care homes and hospitals with stroke, and in hospital it was pulmonary embolism. So this shows excess acute CV deaths by cause and place of death, as explained in the previous slide. Care homes and hospices witnessed a substantial increase in excess acute CV deaths. Herein, stroke, heart failure, acute coronary syndrome, and pulmonary embolism were the most common causes of acute CV death. This finding highlights the susceptibility of elderly and comorbid to wider implications of COVID-19 crisis. Care homes and hospices witnessed a substantial increase in excess acute CV deaths. This finding highlights the susceptibility of elderly and comorbid to the wider implications of COVID-19 crisis becoming infected. Thank you.